Welcome to this explainer. Today, we're taking a hard, objective look at the World Health Organization. We're going to decode the hidden structural and financial constraints they deal with every single day. There is just so much noise out there, right? But we're going to push past all that and just look at the facts, the data, and the history to really understand the unprecedented crisis the WHO faced during the COVID-19 pandemic. We're simply exploring how this massive global institution is actually built, how it's funded, and what happens when its foundations are put to the ultimate test by a global catastrophe. Let's get right into it. Okay, to really understand this, we have to start with this central question that pretty much gripped the entire globe as the COVID-19 crisis was unfolding. Why did the world's premier health body seem to struggle exactly when humanity needed it the absolute most? I mean, when we think of the WHO, we usually picture this supreme, powerful global authority, right? Like an agency capable of just sweeping in and instantly managing an outbreak. But the reality on the ground, it was way more complicated than that. Unpacking this means we've got to look at the immediate pressures they were facing, but also, importantly, the historical baggage they were carrying.
Well, the immediate problem was severely compounded by a massive financial threat. A whopping 15% of the WHO's entire budget comes from just one single nation, the United States. And during the height of the crisis, the U.S. administration, who were looking for answers and a scapegoat for surging domestic cases, threatened to just completely cut off this vital funding. They pointed the finger squarely at the WHO and China. Now, whether you view that move as justified or not, from a purely structural standpoint, the sudden threat of losing 15% of your operating budget right in the middle of fighting a novel global virus, that is a literally paralyzing shock to any organization's system.
But here's the thing. The hesitation wasn't just about immediate funding. It was actually rooted in this historical Goldilocks dilemma the WHO has been stuck in for years. Back in 2009 with the swine flu, the WHO acted really aggressively and declared a pandemic right away. The death toll reached about 18,500, which thankfully was far lower than initially expected. But the result? They were heavily criticized. People accused them of overreacting, wasting money, and causing a bunch of unnecessary public panic. Fast forward to the 2014 Ebola outbreak in West Africa. Still stung that previous criticism, they were slow to act. And this time, the global perception was that they had just completely lost control of the situation. So they're constantly paralyzed by this fear. It's a classic trap. Act too fast, and you're an alarmist. Act too slow, and you're incompetent.
And you can really see how this historical pattern of hesitation played out during the biggest pandemic since the WHO was founded in 1948. Just look at the timeline. The very first positive case was detected in Wuhan on November 17, 2019. But China didn't actually report this to the WHO until December 31st. And then it took the WHO all the way until March 11, 2020 to officially declare it a pandemic. You can clearly see these agonizing gaps in time. And those gaps, they basically represent the internal struggle of an organization that's desperately trying to balance diplomatic relations, verify early data, and navigate that terrifying Goldilocks trap we just talked about.
Now, during that incredibly critical window, the WHO made a series of early decisions that, fueled intense global scrutiny and political tension. First off, they relied almost entirely on the Chinese view of the outbreak, without sending in their own independent experts to Wuhan to actually verify the data on the ground. On top of that, WHO officials consistently made public statements praising China's containment efforts. And perhaps what's seen as the most controversial move in hindsight, they issued advisories suggesting that healthy people didn't really need to wear face masks. You take all these actions collectively, and it created this massive credibility crisis for the organization, right as the virus was going global.
So this brings us to a really crucial point. We need to uncover what we might call the illusion of power. Because when we look back at those early missteps, relying on a single country's data, delaying the pandemic declaration, we really have to ask, just how powerful is the WHO actually? The public largely expects the WHO to act like this aggressive, independent global health police force, right? Someone who can just bust down doors, demand the raw data, and enforce strict health mandates. But is that expectation actually grounded in the reality of their charter? Honestly, the reality of their budget shatters that illusion completely. In 2019, the WHO's annual operating budget was roughly $2 billion. Think about that number for a second. $2 billion. That is literally smaller than the annual budgets of a lot of individual university hospitals. For an organization that is literally tasked with monitoring, researching, and responding to health crises for the entire planet, their financial resources are incredibly small and, frankly, fundamentally inadequate. You simply cannot act as a global health police force on a localized clinic's budget. It just doesn't work.
But actually, the problem isn't even just that the budget is small.
It's how it's fundamentally structured. A massive 70% of that budget comes from voluntary donor contributions. These are funds given by specific countries or organizations, and they are usually highly earmarked for very specific projects that the donors themselves care about. So that means only 30%, just that small remaining slice, is the flexible, core budget that the WHO actually controls and can deploy wherever they see the greatest need. Because of this extreme reliance on donors, the WHO is essentially stripped of any real financial agility and autonomy.
And structurally speaking, the weakness isn't just financial either. It's legal. Take the World Trade Organization, for example. The WTO actually has the formal power to bind its members to agreements, and they can sanction them if they break the rules. The WHO, they have absolutely no formal ability to bind their members to taking any action and zero power to sanction them for noncompliance. So despite the immense responsibility the global public places on the WHO, they actually have surprisingly little hard power to enforce anything at all.
Which brings us right up against what we can call the sovereignty wall. Here is the hard, unavoidable truth of international governance. The WHO is never larger or more powerful than its member states. Period. It relies entirely on cooperation and goodwill. Sovereign countries legally have the absolute right to just deny the WHO access to their territory. If a country decides they don't want to share their health data, or if they refuse to let independent experts cross their borders, the WHO simply cannot force them. Their hands are totally tied. Furthermore, these constraints go deep into the organization's internal leadership and daily operations. It's a classic constitutional problem across a lot of UN agencies. The head of the agency is elected with the backing of powerful member states, and because a leader typically serves 2 5-year terms, they are constantly relying on the political goodwill of those exact same powerful nations to get reelected. That totally strips away the kind of independence you need to boldly challenge a member state when things go wrong. Add in the fact that constitutional amendments require a strict 2/3 majority vote. Plus all the deep, complex tensions between the central headquarters and the regional offices, you've basically got a perfect recipe for bureaucratic gridlock. So where exactly does this leave us today? Well, while the heavy politicization and these deep structural failures are definitely concerning, they also hand the global community a crystal clear opportunity. We have a moment, right now, to rethink and rebuild the underpinnings of our broader global governance architecture. Look, great power politics are always going to exist, for sure, but the crumbling edifice of our current institutional framework means time is seriously running out. So what would viable, effective new systems actually look like if we built them today? Well, the data points us to 4 highly actionable structural reforms that could finally give the WHO the agility it needs. First, we have to fix the leadership trap. Implementing a single, non-renewable term of 6 or 7 years gives the leader the true authority to act independently without constantly stressing about re-election politics. Second, outsource the highly specialized functions to other expert global agencies, like the Gavi Alliance, so the WHO can focus purely on top-level global leadership. Third, we need to break away from that 70% voluntary funding trap and significantly increase flexible funding that is tied directly to delivering value. And fourth, leverage outside expertise by fully unlocking the WHO's Framework of Engagement with Non-State Actors, or FENSA. If you want enhanced autonomy, you absolutely have to have these built-in transparency mechanisms. And that brings us to a really high-stakes warning about our future. If these fundamental, foundational flaws aren't rectified and responded to with a massive sense of urgency, our global governance architecture might witness unprecedented fragmentation. And it'll happen exactly at the time in human history when we literally need it the most. As the analysis points out, that kind of failure wouldn't just be some administrative annoyance. It would be an absolute travesty for the most vulnerable and weak nations of the world who rely completely on this international safety net to survive. So wrapping this all up, the data shows us incredibly clearly that the WHO's hands were largely tied by a mix of inadequate funding, a serious lack of legal authority, and just intense political pressure. So the ultimate question we face as a global community going forward is this. If we allow global health governance to fragment right now, instead of fixing it, who will be left to protect the most vulnerable nations when the next inevitable crisis strikes? Thank you so much for joining me to decode this incredibly complex topic. Keep asking the hard questions, keep looking at the data, and I'll catch you next time.